Welcome to the Studying Medicine Abroad talk. This is for anyone considering studying medicine. Maybe it's your first choice to study abroad. Maybe it's a backup option. We're here to tell you everything you need to know about studying medicine, postgrad or undergraduate. So I'm just going to share my screen. Can you see my screen? If anyone can message in the chat.
I can see it. You guys can just confirm, but yeah, I can see the screen.
Perfect. Okay. So, studying medicine abroad, undergraduate medicine. About me, my name is Chedza. I'm a fourth year medical student. I'm doing undergraduate medicine. So I started in straight after A-levels, year 13, I went abroad and I'm studying in Czech Republic, and I am co-founder of Med2B Consultants. So why consider studying medicine abroad? You get to study the degree of your choice. If maybe you couldn't get in England, you can still pursue your career, experience different cultures, step outside your comfort zone. And it's an experience that you're going to remember for the rest of your life. It's very unique, it's very fun, and a degree is only for a few years, but a career is forever. So if possibly you don't get in and you're considering doing something else, I would say reconsider doing medicine maybe just somewhere else, because at least you get to follow your career path. You're going to be in it for maybe 50 years, 60 years, however many years. So it's worth taking a few years out. And I would say in 5 years from now, what decision would you be glad that you made? Would you be happy that you pursued your dreams, or would you be happy settling for something else? What countries offer undergraduate medicine in Europe? Virtually all countries in Europe offer undergraduate medicine. So you should apply based on accreditation. So whether a degree is accredited by the GMC, which is the General Medical Council, that means that when you come back to the UK, it will be very easy and they will recognize your degree and accept it. You can also apply based on rankings, so how high it's ranked. It could be a good reflection of the education system and also the area that you want to live in. I currently study in the Czech Republic. How to apply? There's loads of different agencies that you could use to apply. One of them is Medical Doorways. There's also MedLink and Study Medicine Europe. Some of them you have to pay for, some of them are for free. So definitely look into that. I went through Medical Doorway and the advice was all for free. I paid a little bit of money to sit the exams, which I'll go into later, but virtually it was very affordable. Tuition fees. This ranges from about 3,000 to about 10,000 pounds, I would say. I pay about 8,000. And once you're enrolled, it's possible to get scholarships for doing work such as research. So I have gotten a research scholarship. Accommodation is a lot cheaper than England. England, it will cost you, for a studio, I would say at least £700, but in Czech Republic, for instance, or other countries, it costs about 150 a month. Obviously, depending on where you're living and factors like that, but generally the cost of living is also a lot cheaper, such as groceries. And something to consider as well is that in Europe, it's also like America, where you can kind of share a room if you want to, and that will split your costs of like accommodation in half. Length of course. So the standard undergraduate medicine course is 6 years in Europe. So in England, it's 5 years, with some universities such as, let's say, Cambridge doing 6 years. In Europe, undergraduate is 6 years, and the first 3 years are usually theory-based, and year 3 to about year 5 is clinical. And then the 6th year isn't really a learning year. you're technically like a doctor, but the 6th year is an internship year, and that's equivalent to foundation year 1 in the UK. So when you come back to the UK, you will start in foundation year 2. So for those of you that don't know what foundation year is, in England, when you've done your 5-6 year degree, you do 2 foundation years where you're working as a junior doctor, and then you specialize after that into your fields. So yeah, grade requirements. When applying, you have to sit tests. Most unis require you to sit a test in 3 of 4 subjects, the subjects being maths, biology, chemistry, and physics. And these tests have like similar concepts to A-levels. So if you pass these tests, the university is quite confident that you will make a good doctor. So virtually the grades that you got for A-level, as long as you didn't completely fail, they're not really that significant as long as you have passed these tests. But then there are some universities that require specific grade boundaries, such as like BBB or maybe ABB, but the majority, what I've seen is that if you are able to pass these tests, then you are in. Going back to the UK or US. So going back to the UK, like I said before, it's fairly simple if the university is accredited by the GMC, and if the country is in the Eastern European area, such as where I am, you don't need to sit another test, such as like a PLAB, when you go back to the UK. The only thing that you'll be sitting is an English test, just to make sure that you're able to communicate with patients properly and that your English is okay, which should be fairly simple for all of us. And we will need to complete a situational judgment test as well, but so will the UK students. So virtually there's no difference except for the fact that you're seeing an English test from somebody studying in like Eastern Europe and a UK student. And going to the US, you have to sit 3 steps. So these are 3 exams. There's step 1, step 2, and step 3. Step 1 is heavy, it's theory-based. It's a very long exam, it's about 9 hours. And people usually take it in their 3rd year of medical school. And step 2 is clinical-based, and it's usually taken like the last year of medical school. But these exams can be taken anytime. If you want to sit them all in 1st year, good for you. If you want to sit them all 5 years after you graduate, good for you. And then the 3rd step, you can choose to do it before you go to the US or during your residency. Then graduate medicine. Chipe.
Hi guys, I'm Chupo. I'm a 1st year medical student right now, but I'm a graduate student. So I got an undergrad degree from University of Leicester, which I finished last summer, and I'm currently studying in Georgia. So that's a bit about me. Okay, so in terms of graduate medicine, since it's like a bit more specialized, there are a set list of universities that offer the course in Europe. So the main ones, as you can see here, they're in Georgia, Poland, and Ukraine. These are the list of like the top recommended ones, but there are a few others that also offer graduate medicine. So how it works is they basically use your degree that you've already achieved, and you'll obviously have the modules that you've done in your degree, and they will use that to either exempt you or to push you forward on the undergraduate degree. So that's how you're able to do the medical degree in a shorter space of time based on having a previous degree. So in terms of how to apply, I think the route is quite similar to undergrad in that most people that I've spoken to apply using agencies. I don't think I've heard of anyone applying directly to the university, just because these agencies are able to help you with like translation of documents and advise you on your different options. So I think that's definitely the best way to go. As Chiesa said, some of them do charge a fee and some of them are free, and you might need to pay for like maybe sitting exams. I personally used Study Medicine Europe, which they did charge me to help me get a place. That's the agency that I used. Okay, so in terms of the grades, you need a bachelor's degree, a BSc, in a related subject. I studied medical biochemistry, but I know people who did pharmacy, I know people who did physical therapy actually, and then biochemistry, physiology, different things like that, but they should be in a related, a biomed kind of subject. And then in terms of the A-level grade requirements, most of the universities don't have specific grade requirements. So AAB, BBB, they don't really specify on that. But the university that I went to wanted me to have biology, chemistry, and maths. And when I was looking, some other universities specified those A-level subjects, but not a grade boundary, which is something that maybe you don't have to worry about if you're going down the grad route. Okay, so tuition fees, they vary depending on the university and the country. But one thing that I've noticed, in all of them, they're all significantly cheaper than UK tuition fees. As some of you may know, in the UK, it's £9,250 a year for your tuition fees. In Europe, I'm in Georgia and I pay $7,000 a year, which is about £5,500. For the length of the course, the standard is 4 years, and even for graduate medicine in the UK, for people who apply to it's called the Accelerated Medical Program or graduate medicine, and they would do 5 years here as well. So time-wise, you're not really like missing out or taking longer. Some places actually offer it in 3 years, and some places are 5 years for their graduate medicine. My course that I'm at is 4.5 years. So yeah, it is a shorter option. If you already have a degree and you want to top it up and do medicine, you don't have to go and then do the additional 6 years. Okay, so going back to work in the UK, as some of you may know, in order to like work and be registered and licensed in the UK, you need to be licensed to practice by the General Medical Council, and they have a certain criteria for international degrees, people who are holding medical degrees from outside that want to then come and practice in the UK. So the main thing that I've seen they look at is the time that you've completed. So they want a minimum of 5,500 clock hours to be done in at least 3 years. But that, if you're doing graduate medicine and your course is 4 years, 4.5 years, you would have fulfilled that anyway. So that's not typically something you need to worry about unless your course is 3 years. Then you need to make sure that you're getting the right clock hours. And then in terms of sitting a test in order to come back to the UK, as Chieta mentioned, countries in the EEA are not required. But if you're not in the EEA, you may be required to sit the PLAB test before registering. So the GMC on their website have a lot of information about like what degrees they accept, what degrees they don't accept, their criteria, and they're always like changing it and updating it and reviewing it. So it's something that as a graduate, I feel like it's important to keep an eye on. But they are really you're able to talk to them. I've contacted them a lot and they reply and they're really helpful. So that's good that we have kind of that access to them, and it's like comforting, especially if you know you want to come back and work in the UK. Okay, cool. Any questions?
I'm gonna stop sharing my screen. Does anybody have any questions? Someone said on Instagram, what do you like the most about studying abroad? Do you know the answer? What would you say you like the most so far? I know it's only been a year.
Yeah, I'm kind of new, but I think it's nice. It does seem a bit daunting, so it's very normal to feel like it's this big thing. But I think once you're there, it's not as bad, and you learn to adjust. And one of the pluses, as Chieta mentioned, is it being so much cheaper. Like the UK are ripping us off, guys. I'm sorry. When I went there, I remember it's like everything's much cheaper, accommodation wise, grocery wise, and it's an experience, as Chieta also said.
Yeah, I think for me, so one thing is that I'm not gonna have student debt. I know you've got some already, but like going forward, because I'm looking at some of my friends' debts and I'm like, wow, how have you spent £60,000? Like, just knowing that I don't have that like loan on me, it just feels really good. And another thing is, there is a lot of opportunities that I wouldn't have gotten if I went to med school in the UK. So, for instance, I got a scholarship to study in America, and they're also paying for my living fees and all of these things. But it's not like clashing with my education. I can do them both at the same time. But I know a lot of cases where, if you study abroad in the UK, you have to take an extra year out. I don't have to spend another year. And also, like, I feel like it's quite one-to-one because there's two programs. So there's like the program for the people that speak the native tongue. So there's a Czech program, and then there's a program for the English speaking students who pay for their school fees. The Czech students don't pay. And that's just like the general thing in Europe. The students in that country or that speak the language, they don't pay. So there's less English speaking students, which means that there's more like teacher contact. There's more like, if I want to go and volunteer, or if I want to go and do this and that, they will give me that because there's not many of us. So I appreciate that as well. There's another question in the box that says, if I study abroad and come back to the UK, am I going to be at a disadvantage to people who studied in the UK for getting jobs in the UK? So you're not supposed to be. They say that you're not at disadvantage. And to be honest, I don't think you are, because we're sitting the same test. I'm not sitting any extra tests, and we're all applying for the same things, we're all getting the same interviews. I believe as long as your degree is accredited, you're not at a disadvantage. But if it's not, it gets a bit tricky. How often do you get to come back to the UK? Oh, I come back all the time, guys. I used to come back once a month, but I don't do that anymore because it's getting a bit harder. But in terms of money-wise, because there's direct flights and also because of COVID and stuff, I have been getting very, very cheap flights. Some of my flights are under £10, which it's cost me more to go from Kent to London than it does sometimes to fly back. So it's very convenient. What about you, Chipper? Would you say you come back often?
I ended up coming back just during my term breaks, but yeah, I found because it's off peak, the flights are quite cheap. So yeah, it's not, and it was quite easy. Yeah.
How much would you say it cost you flight wise?
Because I'm in Georgia, it's a bit different. It's not a direct flight. I actually had to go through Turkey, but my flights were, when I came home, £88, which is a bit steeper than £10.
It's cheaper than if you bought a ticket to go up north.
But also in the grand scheme of flights, I feel like it's not that bad. Literally, I used to go from Kent to Leicester when I was studying in Leicester, and I've hit £60-70 to get a train to Leicester. So yeah.
Yeah, I think that's also something to consider if you go abroad, whereabouts you're going, how easy it is to access. But I wouldn't say £80 is a lot to fly out to a whole different country. How can I find out what degrees are accredited? So usually agencies won't really offer you universities if they're not accredited by the GMC, but you can also just check it up yourself. So as Chipo said, you could call them, or there's a website. I can send it in the year 12 group chat, and you can just type up the university and it will tell you where you can like work after. And most places that offer to you, you can work anywhere in the world. You can work in England, you can work in America, in Canada, in Australia. So yeah. Is there any other questions? Okay. I think that's all then. Thank you all for coming. If you do have any more questions, feel free to message me. And yeah, have a good night. You're welcome. Okay, let me just